Today's lecture is on healthcare and the healthcare team. Healthcare trends. Technology. Our electronic health records. They replace paper records, quick access, and fewer mistakes. And more than one person can be on the same record at a time. Preventive care and wellness, such as whole foods, little or no processing. Wellness is nutritional focus, including fitness. More health trends include the aging population, and the effects of baby boomers entering Medicare. Physicians' offices, clinics, and urgent care centers. And ambulatory and outpatient care facilities at hospitals are current day healthcare trends. Long-term care for the frail and elderly and disabled. We have new long-term care insurance that became active in the early 2000s. Hospice care. Hospice care is for patients with less than 6 months to live. It can be in a hospice center, it can be at home, or it can be in a rehab center or hospital that has a wing for hospice care. The response to the Affordable Care Act was comprehensive care by a team of providers. It's patient-centered care with the patient as the team member and in control. It's coordinated care across healthcare services. The primary care physician knows what's going on with the specialty services. Accessible services enhanced by technology, and this is the EMR or the EHR. Quality and safety are based on research evidence. Medical specialties in the healthcare field. There are 24 specialties and subspecialties recognized by the American Board of Medical Specialists. ABMS purpose is to support professional development and certify physicians. As board certified physicians, you have to have education and licensing process may take 9 to 12 years, and there are multiple testings may be required from that as a physician out of medical school to be a licensed practitioner, a licensed physician, and then more education and licensing for the specialty you choose to go into. Cardiology is a large field with heart disease, the #1 mortality. So what does that mean? It means heart disease of any kind is the #1 killer in the United States. This is the #1 thing that people die from. ECGs, also known as EKGs, are the large part of a medical assistant skill. You can see from the film that this person has EKG leads on, a blood pressure cuff, and is on a treadmill. We call this a cardiac stress test. You provide education for patients and needed on diet and exercise for prevention and rehabilitation as ordered by the practitioner. Bariatrics is a specialty field of medical surgical treatment of obesity. Dermatology takes care of diseases of the skin, hair, and nails. Osteopathy looks at the whole person approach. And osteopathic manipulative medicine means hands-on techniques to improve function and restore health. Osteopathy is based on the bones in the body being aligned correctly so that muscles can be aligned and healing energy can flow through the body. Emergency medicine speaks for itself where you work in emergency departments. Endocrinology is the treatment of excess or deficient levels of hormones which regulate glandular function. One example would be for the decreased or no levels of insulin in the body from the pancreas, which we call diabetes mellitus types 1 and types 2. Gastroenterology is to treat disorders of the gastrointestinal tract. Gerontology treats problems and diseases of older adults. Gynecology treats diseases and conditions of female reproductive system. And obstetrics deals with delivery of infants. Internal medicine treats diseases or conditions related to internal organs and requires additional training, which focuses on one of 13 subspecialties. Nephrology is the study, diagnosis, and manage diseases of the kidney. Neurology deals with the nervous system, your brain, and the central nervous system and the appendicular nervous system. Nuclear medicine is related to radiology, and it's used to diagnose and treat diseases. It's used to show organ function and structure. And one way we use nuclear medicine is in putting a nuclear reactive dye into your body when we do a CAT scan or an MRI. Obstetrics involves pregnancy, labor, and delivery of an infant or infants. Oncology work involves cancer patients. It includes chemotherapy and radiation and other forms of treatment. Ophthalmology deals with eye-related problems. You see an optometrist or an optician. Orthopedics works with the musculoskeletal system. Otorhinolaryngology treats ear, nose, and throat conditions such as tonsillitis. Pathology is the study of disease, and there is a pathology department in every hospital as part of the laboratory service. It investigates biopsies from cultures and tissue samples to determine malignancy, such as breast biopsies. You perform autopsies to determine the cause of death, as a forensic pathologist or an anatomic pathologist. Pediatrics and adolescent medicine is care for children, teens, and young adults. Physical medicine deals with specialization in rehabilitation and is certified by the American Board of Physical Medicine and Rehabilitation. If you break your arm and you need physical therapy to gain strength in your arm again, you will go to rehab or a rehabilitation area, and you may be overseen by a physical board-certified physical medicine and rehab physician. Podiatry treats disorders of the foot, and in some states, the ankle and leg are included. Plastic surgery, it's reconstructive, corrective, and it improves body structure. Proctology deals with the anus, rectum, and intestines, and radiology works with imaging for diagnosis or treatment for cancer. We use radiology, take x-rays to see if the bone is broken or not if you have an injury. Sports medicine is the treatment and preventive care of athletes. It's about a 20-year-old specialty area. Surgery is the use of hands and instruments to correct deformities or disease, and there are many, many specialty areas for surgery. Urology treats diseases of the kidney, bladder, or urinary system, and the male reproductive system. And this ends today's lecture.